everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over the job overview of an orthopedic nurse. I'm going to be covering who these people are, where they work, their job duties, their educational requirements to become one, how much they make, and the pros and cons of this nursing specialty. But first, let's talk about who they are. These are registered nurses who work with patients that are suffering from musculoskeletal issues ranging from joint/knee problems, bone fractures, arthritis, osteoporosis. And they work closely with orthopedic doctors and surgeons. Where do these nurses typically work? They typically work in hospitals. In hospitals, they have units that are dedicated specifically to orthopedics, and anyone who has an orthopedic problem goes onto that unit. Rehab centers, which is a lot of places where after they're in the hospital, if they need rehab, they go there. Or outpatient clinics. Typically, they've been in the hospital and they're following up with the doctor after the hospital. So that is what an outpatient clinic is. Okay, job duties, what do they do? These nurses do a wide variety of things, but here's a little bit more of a specialization of what they do compared to another nurse. Of course, they develop and implement a plan of care to help patients meet their specific orthopedic goals. They help maintain pain control, especially for these post-op patients. These patients who have these musculoskeletal problems have a lot of pain, especially after surgery. So that is one of the goals as a nurse. You'll be given a lot of medications. They help properly position the patient, teach them positioning techniques and how to use assistive devices. They assess for any problems after surgery that the patient may have, such as deep vein thrombosis or an ileus. They help recover the patient from surgery. They help the patient ambulate and transfer, because it's so important that you get the patient up and moving out of bed. They give lots of medications like antibiotics. They provide the patient and their family education over the musculoskeletal disorders, the pain management, and activity and ambulation. So how do you become an orthopedic nurse? Okay, first what you want to do is you want to get a nursing degree. You can either go through an associate's program, an ADN, or a bachelor's program, a BSN. You have to pass the NCLEX RN exam to become a licensed registered nurse. Then you just get a job on an orthopedic floor, typically in a hospital. That's where a lot of new nurse graduates like to go, and they will provide you with on-the-job training. You will learn how to be an orthopedic nurse. Now, it is optional. A lot of employers offer this. Some employers will even pay for you to get this certification. An orthopedic nurse certified, an ONC, this is where you get the credentials of being an orthopedic nurse. One of the benefits of this is that you get a higher base pay from what you would normally make if you weren't certified. To set for this exam, you have to have at least 2 years of nursing experience, and you have to have completed 1,000 hours working in an orthopedic setting. Then it's optional. You can complete a review program. It's usually highly encouraged, so you know what's going to be asked on the exam, but you don't have to. And then you pass an exam and you become orthopedic certified. Okay, so how much do orthopedic nurses make? According to payscale.com, nurses that were certified orthopedic nurses made around $50,868. And this was an average for all the orthopedic nurses who were certified, regardless of where they lived, years of experience, and that can always determine how much you make. So keep that in mind. Okay, so what are the pros and the cons of this profession? Because just like with any profession, you have your ups and your downs. Okay, pros. A lot of nurses reported that they love helping patients get better from an injury. They come in, broke a hip, they've helped that patient recover, and that patient's doing great, and they get to go home. They love seeing that, have some positive outcomes. They work relatively with healthy patients compared to other specialties, because a lot of times these patients have just got injured at home or something like that, and they're relatively overall healthy every other system except for their bone system. Lastly, they enjoy just caring for patients and their families with orthopedic problems. That's what they love. That's a specialty they love, and they love being able to do that every day and deal with those type of issues. Okay, cons. What do they not like? Okay, one thing was dealing with patients with unrealistic expectations, knowing that this probably isn't going to happen, but the patient thinks this is going to happen, and the patient gets frustrated. So that's a little bit hard. Next, this position is hard on your body because you have a lot of lifting and pulling to do, because a lot of your patients are immobile. They can't move as well. They can't bear weight as well. So it's very hard on the body. And lastly, it is hard seeing a patient who was physically active in their life become disabled because of an injury. So that is hard. Okay, that is a little bit about an orthopedic nurse. Please check out my other nursing specialty videos, and thank you so much for watching this video, and please consider subscribing to this YouTube channel.